With outcomes-based healthcare, we mean to more precisely measure the health outcomes from each intervention in the healthcare system, be it from a medicinal product or from a healthcare service. And then to use this collected outcomes data to improve the patient pathway. So you can compare and contrast different interventions in the healthcare system and direct resources to the interventions that create the most value for the patients and the best health outcomes. In the end, also the financial incentives in the healthcare systems should be aimed at these goals. So instead of rewarding volumes of care produced or number of pills sold, we start rewarding the actual health outcomes that they bring to patients and the overall value created for the healthcare systems. The role of health data for outcomes-based healthcare is very important. It's key. Without having access to high-quality data, you cannot monitor the health outcomes for patients. So you cannot monitor the effectiveness and the value created by different interventions, products and services in the healthcare system. So this kind of model is depending upon having access to high quality and standardized data where you can follow the patient throughout the patient pathway through the healthcare system and then tie this data, these outcomes to these financial rewards. There are several hurdles against getting access to this data for outcomes-based healthcare. There is a lot of data out there in our healthcare systems. The problem is that this data is often stored in silos. Even within the same hospital, it can be different databases containing different kind of patient information. And in a whole healthcare system, you have the hospitals, you have the primary care, you have maybe claims data from the patients, you have disease-based registries, and this data is often not linked, it's not standardized. The health outcomes are not measured in the same way. So there are challenges in bringing this data together so you can link it up and also do this, of course, in a safe way that protects the privacy of the patients. IHD, I think, can play a very important role as a neutral platform, a public-private platform, where all stakeholders can come together and work towards common goals on getting this interoperability and the data quality that is necessary, and really implement the necessary standards and quality guidelines in hospitals and other healthcare institutions to make this work and make it work in a safe and secure way.